Hi, this is Dr. Desmond White. Today, a patient of mine asked me one interesting question. The patient said, well, Dr. White, I saw you for other things, but my relative is undergoing a procedure. The name is called adenoidectomy. It's to remove something, I think some swollen lymph node in the inside the mouth. The doctor, another doctor, not me, of course, okay, give me this financial counseling form. This is what she's going to charge me for my relative surgery. Is the charges that she charge, is it fair? Is it reasonable? Is it too much or is it too little? So sometimes patients ask me like that. And once and for all, let me teach everybody how to use Ministry of Health website information to answer this sort of question. First, you go to Google, you type the word here, you type the word MOH fee benchmark 2023. Okay, you type like that, then you type. You see, this is a Ministry of Health website, it's safe. Okay, you click onto this again, and this one tells you under Ministry of Health, hospital bill and fee benchmark. You then click onto learn more here. So this is for all the surgery. For this one, is doing something called adenoidectomy. To remove the adenoid, which is the lymph node within within the mouth. You search. Then it's come out, okay, it's a throat. Removal of tonsils and other related tissue, okay, including adenoidectomy. So you click onto this one, you go to the hospital bill overall, okay, yeah. Then, okay, so these are the bill now. For day surgery in the private hospital is this amount, but this is the lowest. So lowest is 11,600. This is the highest, which is 14,600. So total patient for adenoidectomy as an inpatient for day surgery, 1 day stay in the private hospital, the fees range from 14,600 to 11,600. Of course, if you go to a public hospital as a subsidized patient, it's much cheaper. So the range is 11,600 to 14,600. If your fees that the doctor tell you what he's going to charge is within this range, this is probably not unreasonable, as this is within the range that what MOH says. But if the fees are way too high, much higher than that, then maybe you should ask the doctor, is there any special reason? Sometimes there's special reason. Maybe some patient need special equipment. Some patient need to be observed longer after the surgery. Some people have other risk factors that need close monitoring. Or some patient need a special implant that are not reflected in the average. Or sometimes patient need a special skill that only 1 or 2 doctors in the world can do, something like that. So if your fees, if the total cost that they quote you is within the range, that's probably reasonable. But if the doctor quoted you a fees that are much higher than the range that you can collect from this MOH website, then you may want to ask the doctor for the reason. Usually there's a good reason. So I repeat, the whole thing is actually called under MOH, under hospital bill and fee benchmark. Type in Google and you go to step by step and you can find out what is the average fee for your procedure. I hope this helped. This is Dr. Desmond White.